Place the patient in a side-lying position to allow access to the nephrostomy site. Place a disposable drape under the nephrostomy site. Nephrostomy tube care. Ensure that the drainage bag and tubing system are securely attached to the nephrostomy tube. Trace tubing or catheter from the patient to point of origin. 1. Before connecting or reconnecting any device or infusion. 2. At any transition, for example, new setting. And 3. As part of the handoff process. Assess the dressing around the tube and surrounding skin for evidence of urine leakage, bleeding, or skin irritation. Change the dressing as needed per the organization's practice. Label the dressing per the organization's practice. Ensure that urine is able to flow freely through the tubing system. Do not clamp the catheter unless ordered by the practitioner. Check for kinks or pressure in the tubing system. If using a leg bag, ensure that the drainage bag is attached to the patient's leg. If using a bedside drainage bag, ensure that the bag is secured on the bed and lower than the kidney. Many patients use a leg bag during daytime hours to permit greater mobility. Empty the smaller leg bag before it is full to prevent urine backflow into the kidney. At night, the patient should use a larger bedside drainage bag. Secure the tubing to the patient's flank with tape or with a catheter securement device to ensure that no stress is placed on the nephrostomy tube. If leakage is observed, reassess and secure all connections. If leakage continues, change the tubing system and drainage bag using aseptic technique. If the catheter or tubing is accidentally dislodged from the nephrostomy site, cover the site with a dry dressing and call the practitioner. Nephrostomy tube flushing. Drop 10 milliliters or the prescribed amount of sterile normal saline, or obtain a pre-filled syringe of normal saline. Locate the irrigation port. Trace tubing or catheter from the patient to point of origin. 1. Before connecting or reconnecting any device or infusion. 2. At any transition, for example, new setting. And 3. As part of the handoff process. Do not force connections and avoid workarounds per the organization's practice. Check vital signs immediately after making any connection per the organization's practice. Remove the cap from the irrigation port and discard it in the appropriate receptacle. Cleanse the irrigation port with an antiseptic wipe and allow it to air dry. Insert the syringe into the irrigation port. Turn the stopcock so urine will not flow into the drainage bag. Gently flush the catheter with 2 to 10 milliliters of normal saline per the practitioner's order or the organization's practice. Do not aspirate the solution back into the syringe. If resistance occurs, have the patient roll onto his or her back and then back onto his or her side. Never force the solution into the catheter. If resistance continues, notify the practitioner. Turn the stopcock so that urine will flow into the drainage bag. Remove and discard the syringe into an appropriate receptacle. Cleanse the irrigation port with an antiseptic wipe and allow it to air dry. Place a new cap on the irrigation port. Nephrostomy tube removal. Administer pain medication. Reassess the patient's pain status, allowing for sufficient onset of action per medication, route, and the patient's condition. If present, cut the suture securing the tube to the skin using sterile scissors. Remove the catheter. Small bore catheter or pigtail. Release the locking mechanism. Gently remove the tube until the tip is visible. If there is any resistance during the removal, Stop the procedure and notify the practitioner. For a wide bore catheter, attach a syringe that can accommodate the amount of fluid in the balloon to the tip of the catheter and allow the balloon to deflate. Gently remove the tube until the tip is visible. If there is any resistance during removal, stop the procedure and notify the practitioner. Apply a dry pressure dressing to the site. Label the dressing per the organization's practice.